Hello, my name is Kim Knight and I'm the director of the Mickel Therapy Clinic in Auckland, New Zealand, and I'm here to help you get some answers and to help you heal from chronic fatigue, fibromyalgia, irritable bowel and other conditions. So today's topic is symptoms. First of all, what are symptoms? Well, usually we feel some sort of mental pain, mental unhappiness, or we might feel emotional unhappiness, or we might feel a physical pain. And Wikipedia's definition of symptoms is departure from normal function or feeling, indicating the presence of disease or abnormality. So when we get a symptom, we know that something's wrong because it wasn't there before and we were fine. So what do we do when we get a symptom? Now, the normal thing that a lot of people do is they immediately run for the medicine cabinet or down to the local pharmacy to get some pain eradicating medication, maybe something to stop the sneezing if you have hay fever, something to stop your stomach churning if you have stomach problems, etc. So what I'm trying to say here is that normally what we want to do is reach for some medication. Now, why do we do that? Because we want to get rid of the pain. Now, Mickel therapy takes a very different perspective. We see that the body is a very intelligent organism and that it never makes mistakes. In fact, it's always right. And it's our mind that usually gets things wrong. So, when we look at symptoms, instead of trying to eradicate them straight away, which really means that we're trying to shoot the messenger, what we do is we stop and say, that's interesting, I've got a symptom. I wonder what my body is trying to tell me. Now, this can be difficult at first when you haven't trained yourself into this process, but after a while it starts to become easier. So, one of the things we say in Mickel therapy is that a symptom never comes without a preceding emotion. Now that's interesting, isn't it? How many people have looked at it like that? What if behind your symptoms of fatigue or fibromyalgia or irritable bowel there were emotions? What if you hadn't actually identified how you were actually feeling and that your body, in its attempt to get your attention, had escalated what it was feeling into more severe physical symptoms? Now, this may sound extraordinary if you've never heard this before, but for people who undergo Mickel therapy, it quickly becomes quite clear that this is very, very true and accurate. And when they start using the tools of Mickel therapy, they start to learn how to identify what their body is really telling them through their symptoms, to the point that their body no longer has to send them. So here's an exercise to take away with you. Next time you have a pain, rather than immediately wanting to eradicate it or take some medication, just stop. Stop for a minute. Go to a quiet place, take some deep breaths, and ask yourself, how am I really feeling right now? What is going on in my life right now that is perhaps creating some feelings, and some feelings that are not particularly good, perhaps? Now, it may be something that's going on right there immediately, as in somebody's just shouted at you, or it might be something that is ongoing that you're not really dealing with. So stop and look at what is going on in your life, how you're leading your life, and start to work out what is contributing to your symptoms at a deeper level. I hope this has helped. I will have many more video blogs and I look forward to sharing lots more tools with you.